I took my daughter to a doctor's appointment about a year ago, and I've got an EMR. The doctor was using an EMR, and despite that, I was still struck by how the doctor, who I know and is very good, spent the whole time like this on the monitor. Would ask her questions, not look at her, but just was, typing. And I, as a doctor who uses an EMR, kind of went, that's not very good doctor-patient relationship. I used to try to type and, be engaged at the same time, and I just gave up on that. So I've gone back to where when I see a patient in the office, I talk to them, I ask questions, do my physical exam, go over management, treatment recommendations, okay. And then I leave and I go into the next room and I input as much as I can, and then I go see my next patient. Because I felt personally that typing and looking at the monitor, I was losing something in that visit and that connection.
As my wife, on the other hand, when she told me that the doctor was on the computer the whole time in her visit and all, and I was like, yeah, doesn't that bug you? Do you not like that? She's like, no, I like it, because that means that she was working real hard to make sure nothing was missed and nothing was forgotten. And I was like, I did not expect that, obviously, because I had my biased question. So I think ultimately what's going to happen is it's going to be, it depends. And when we talk about personalized, contextually relevant, and evidence-based, that's not just with the diagnosis and treatment and interventions. That's also with how you interact with them. Some of the younger ones might say, yeah, just email it to me or text it to me, or I'll just look it up on the portal in 24 hours. I have notifications set up. Others might say, can you give me a phone call? Others might say, can you schedule a follow-up for when the results are back and so we can talk through it in person? And there anything else along the spectrum. So I think what ends up happening is it goes back maybe, or it resets what are the appropriate expectations, or what are the expectations of the patient. And the physicians and clinicians that don't meet those expectations will lose those patients potentially, especially as consumerization, because they'll go to they'll go to the clinicians that not only allow them to integrate their data, make them feel like a true partner with shared decision making, but also satisfy their expectations.